Hi, welcome back. I'm Josh Johnston, and I'm here with Molly Zimmer, who is, okay, I can't see your
That's
tag
okay.
anymore.
I'm
So
so
Innovation
sorry.
and Emerging Technology, right?
Yes, good
at
job.
St. Luke's.
That's correct.
So what does that mean?
Still trying to figure it out.
What do you want it to mean?
Yeah, there we could do that. Well, the innovation piece actually, that's actually the reason that I'm here today, and several members of my team from St. Luke's that are part of the Innovation Center of Excellence. And that really was about establishing a framework and a practice of innovation, basically like how we solve problems in a systematic way. So that's one component of our work, and so that's part of the reason that we support the med tech, the health tech track, and also are working with the corporate innovation track this year. But then the other piece that's really exciting is emerging technologies. There's just a ton. Obviously, generative AI is one, but there's a lot of new technology on the horizon that can really help us solve some of the significant problems in healthcare. So that's a little bit about what we do, like at a very high level.
Yeah. So healthcare is not somewhere that is traditionally seen as a hotbed of innovation, at least within the large hospital systems.
Right.
So, what do you see as the opportunities and the challenges of working from the inside versus, maybe going and doing it somewhere else?
Oh my gosh, yeah, that's a great question, and it's funny. So, Molly, last year, I did the same kind of thing last year, continuous conversation, and my answer was probably a lot more naive. I've got a whole year of lessons learned under my belt, and I think that what I've learned is there's significant challenges, I think in every large organization, but especially in one as kind of siloed as we can be in healthcare, because there's the business, then there's the clinical side. Even within the business, there's all these different silos, right? And so one of the biggest challenges we've had, especially in an organization as large as St. Luke's, has just been establishing the culture of innovation and establishing a common language and getting people to start to understand that it's okay to take risks and to not always have everything work out the way that we want. So I'd say, if I were to sum it all up, one of the biggest challenges is actually probably toxic positivity. It's this need for everything to always look like it's going well because we are in charge. We're taking care of people and patients at the end of the day. And so sometimes that means we really struggle with trying to do anything different. And we also struggle sometimes to even admit that maybe what we're doing isn't working, because that's a scary thing to say. The bonus, I guess the good side, ending on a positive on this question, would be a lot of people who get into healthcare do it for the mission, and they're excited about new opportunities. They're excited about ways that technology might augment our workforce to give physicians and clinicians more of a breather in their day, more ability to actually have hands-on patient care. So I think in general, what the good side of trying to innovate within the large healthcare bureaucracy is that we're working with really great people who really do want to move the needle. And if we can just get enough of those people rowing in the same direction, I think we can do it.
Innovation, and I say this as a person, this is the way I view my role as well, is being an innovator.
Yeah.
What are the ways that you evaluate success for your group? I don't know if you have real specific metrics or if it's more of an impact, but what does, success, when you're talking about things like culture that are really wishy-washy,
Oh my gosh,
how do you think about, are we making an impact? Are we making progress?
Yeah, that's huge, and you're right. So even as I attempt to answer that question, I probably will struggle to find real concrete metrics for that culture piece, because it is kind of something that you feel. It's something that you feel. But I will give you an example that maybe it's a little more tangible, I guess. When we do, a lot of times what we do with Innovation Center of Excellence is we really are innovation facilitators. So when there's a significant challenge, a big one right now, I think across the country, anyone who uses Epic, there's this thing called In Basket where providers get all of their notifications for everything in one spot. And it's when you've opened up your email and you have 200 unread emails, it's that, but those might be life or death questions, right? They're actually, a really big deal. So we brought a group of providers in who were very frustrated, who'd been working on this about 15 different ways in the organization and kind of on these little silos. Everybody with great intention, but not getting anywhere, all kind of pulling in different directions. And in 2 days of working through our framework, we had 4 solutions that they're going to take forward and test. And I would say that to me is success. That's a success of the framework. And I have seen us swirl for years on a subject like that, trying to do a project meeting every week and kind of work through a solution. But that is one measure of success for the COE. For things like automation or AI, we are actually working on really establishing a clear portfolio with specific metrics. Because again, like we just want to preach that we need to measure things, and if things aren't working, we need to stop or pivot. And so I think that some of the AI projects that we have, we're really working on specific metrics around time savings in particular, and sometimes ROI, if that's appropriate, depending on what it is. So kind of a vague answer, but I think it's super important, and we often forget about measuring things. So.
Yeah, no, I think that's great. And I definitely, as someone coming through Count into the Equifax acquisition and working with a larger company and a bunch of people that I didn't know as well as the people that I work with here, it really resonated with me hearing that idea of kind of getting in that cycle of churn where someone doesn't just necessarily take it and own it and run with it.
Yes.
I think that's a challenge we have in large organizations as innovators is sometimes you're like, it's great to get a lot of opinions and a lot of perspectives, but sometimes you're like, you know what, we really just need someone to do something and then figure out if it's a good idea or not.
Yes.
Give that feedback.
And be able to accept if it's not and not be like, but there's this one tiny little glimmer of hope and let's only focus on that. Yeah, totally with you.
Yeah. So you talked about being a facilitator. Like, who do you work with? Do people bring you things from, externally, or are you getting these ideas from internal stakeholders?
Yeah, good question. We've done a little bit of both. Actually, it's funny, there's some people in this vicinity who we worked with. So we have worked a little bit with a couple of health tech entrepreneurs, and especially in desirability and customer discovery, trying to help them nail down if they have not viable, but if they have a desirable to their customer product. But mostly we work internally, and sometimes I would say even on challenges that maybe don't sound particularly innovative on their face, but again, it's all about applying the way that we think and this mindset to these challenges to get the outcome that's most likely to succeed through testing. So a lot of internal stakeholders everywhere from our marketing team through patient experience. We've kind of helped work through different challenges.
All right. Well, it was awesome to get in a talk with you. We were actually just finding out right before this that we're on a panel tomorrow, making that connection. So we'll do some more of that tomorrow.
That'll be great.
And thank you all for watching. We'll be back, but first, a word from our sponsors.